We're inside one of Cone Health's 2 brand new state-of-the-art cath labs. This is a $30 million project that is opening, that's going to care for thousands and thousands of patients. It's actually part of a bigger renovation, $200 million to the entire Cone Health system to upgrade care for all its patients. Dr. Brabham, tell us what happens in this room.
So this is our new room where we'll be doing catheterizations, where we evaluate people with blockages in arteries in their body and attempt to open them up with stents. We also will do procedures where we remove blood clots from people's legs. And with this type of room, we're able to combine procedures where we would normally be working in the operating room and using kind of the minimally invasive strategies. We'll be able to do all of that over here too. So it's going to have multi-purpose room.
So what are some of the things in this room we're seeing? Can you kind of describe some of the equipment and what makes it special?
Yeah, so well, the most important thing is the space. I mean, it's huge. And with all the equipment that we have to bring in and out for different procedures, this is going to accommodate that very nicely. But what you're looking at here is over here is the X-ray equipment. So a lot of what we do is look at the arteries and veins through the X-ray equipment. So this is kind of cutting edge, or the latest piece of technology that uses X-ray. So it minimizes X-ray to patients and providers, and the image quality is as good as it can be. And so we take X-rays of the patient who's laying down on the table, and then those are projected up on these 2 huge monitors, and so that enables us to see what we're doing.
So you've been here since 2008 at Cone Hospital, and you have seen things change. What was it like when you got here, and what's it like now?
The shift in vascular surgery has been towards the minimally invasive procedures. So if you ask any patient, had they rather have a big, huge incision or have us work through like a needle stick, and everybody says they want the less invasive procedure. And so that's really been kind of the transition over the past 15 years, is everything is shifting towards a more minimally invasive approach. And the only way you can have the kind of results that we expect and the patients expect is to have kind of superior imaging quality and then all the tools and bells and whistles available.
What kind of results are patients getting with the technology and the procedures we're using now?
So, well, for starters, I mean, we got great results when we were operating, and so the challenge has been to replicate that with minimally invasive procedures, and that has happened. So the technology that's built into the products that we use, the stents, and everything, it's giving us similar results, if not better, because the patient's experience and recovery is so much quicker.
They can get back into doing the things they want to do and they need to do.
It used to take months, now it takes days.
How many procedures will happen in this room daily, and how long will they take?
We do such a wide variety of cases. Some cases can take an hour or 2, some of them are less than that. We'll usually do 5 or 6 cases in here a day. But it depends on, the complexity of the case. Some just take longer.
To have patients that you know or that you get to know and then get to see them going on and having happy, healthy lives, what's that like for you?
It's great. To be able to see, it's such a relatively small community, to see people out in public that you've worked on that are doing well, or it just makes what we do very, very rewarding.
Cheryl, let me start with you. How did you design this space, and why is it designed the way it is?
So we designed this space after talking to staff and patients to get their experience in their everyday experiences with healthcare and in their daily work, because our whole goal was to create an environment that had a better feel to it than what healthcare typically does. And so we used as much natural light as we could. We used lighter colors. We created it with a lean view for efficiency, so that the staff that travel within the spaces and that patients came into the space and felt like that they were in an environment where they received the care that they needed and that their providers were close by in everything that we did.
This department, this unit, is getting a lot of use. I mean, this is a really well-needed place in the hospital. So can you talk about how many procedures happen cardiovascular a year?
Sure. Well, cardiovascular disease, unfortunately, is the biggest killer in our community, and unfortunately, it continues to be on the rise. We really haven't done, despite all our best efforts, we really haven't bended the curve on cardiovascular disease. So the older we get, the more patients we see. And our community is growing, so we see more and more cardiovascular disease just in our community. So this is a very busy unit. We treat heart attack patients, we treat patients that need valve procedures, and we're trying to do it in the state-of-the-art facility, which is what this is. And so we do about 6,000 procedures a year. This is connected to the hospital, so if a patient comes here with a heart attack, it's right near the emergency room. We rush them up here. We have 90 minutes from when they arrive to the emergency room to come here and treat them for a heart attack. We beat that almost 100% of the time. So we have really world-class, first-rate care, and these new rooms will allow us to do that even better, and really to also complete a more complex care. Our patients, the people in our community, don't need to go anywhere, east or west. They can stay in their community and have a world-class treatment for their cardiovascular disease. And that's great because their families don't want to travel. They want to be here to take care of their loved ones, and so we've done that in Moses Cone Hospital in Greensboro. Really proud of this new facility.
Do you think people are surprised that this level of care and this level of technology is right here in their backyard?
I think so. I'm from Michigan, so I'm not a Greensboro native. But I was surprised when I came here and I saw the talent that we have here. And I think they'd be surprised to know that we have state-of-the-art cardiovascular care right here in Greensboro. You think about going outside of Greensboro for heart and vascular care, but you don't have to do that anymore. We have a really great, talented team, and now we have the facilities to really equal their talent. So you need the team, you need the facility, you need the hospital, and you need the community to support it. We have all of that here. It's really, really a great thing for our patients.
Cone Health is one of the country's top 50 hospitals for cardio and vascular surgery. You can find out more about the services and about all the programs by going to conehealth.com.